Okay, now I'm going to go over the Tavr CT protocol. I'm not going to go into detail regarding the incidentals, but obviously we are responsible for those, and our cardiologists rely heavily on us for picking them up, as sometimes we may be able to pick up malignancies, for example. On my screen is the panel when selecting one of the gated phases, because the Tavr CT is a gated CT through the aortic root, followed by non-gated CTA of the chest, abdomen, and pelvis. So I've selected the Tavr workflow and has, these elements. The aortic root element should segment the aortic root automatically, and it says to shift left click on the aortic valve, and I'll do that. Let's see how well it does extracting the aorta for us. That's pretty decent. All right, now Tavr has built-in measurement protocols. I'm going to left click here and activate this measurement protocol tool. However, I do not use their protocol because it is built into a Microsoft Word document and we don't have that functionality. So I've created my own protocol so that I can just eventually copy and paste all the measurements from Tavr to the dictation window. My first item are the annular landmarks, and this is the tool that's assigned to that. I've assigned tools for each of these measurements. They just simply need to be clicked on and then used, activated. So we'll try to approximate the annulus to make it easier to get to the annular plane. So right about there is my estimation, and then we'll zoom in. On the axials, we want to identify the right cusp at its lowest or hinge point, and it's right about there. Using the sagittal oblique plane, we'll tilt this red line up and down until we reach the lowest or hinge point of the non-coronary cusp. So moving it down is right about there. And then we'll direct, while maintaining the crosshairs at the hinge point of the right coronary cusp, we'll move the blue line so that it also hits the non-coronary cusp. And now I'll use the red line on the coronal oblique window to do the same for the left coronary cusp. Find its hinge point. It's probably right around there. Zoom in. And now I can activate the landmarks tool, check delete landmarks afterwards, apply, and then we'll just click on the cusps and then we'll get a fluoro angle. And then again, the appropriate tool has already been preset, assigned to each of these measurements. We'll just left click there. It's gonna capture that measurement, but we need to capture the images as well on top of the measurements. So every after measurement, I'll hit C to capture, and we can call this the aortic root. It'll go out to the output panel, there, our first image. The next measurement is the annulus. This is the assisted distance pair tool. We left click to activate the tool and then left click and drag on the vessel we're measuring. That's pretty good. If I needed to edit the outline, I'll shift left click to do so. Again, C to capture. We'll now move to the sinuses of Valsalva, an average diameter. Again, assisted distance pair tool. That's pretty good outlining. C for capture. Move up to the sinotubular junction. There's some motion artifact in this patient. Pretty reasonable outline again. C for capture. And now the next two measurements are the distance of the RCA and left main coronary artery ostia from the annular plane. The annular plane, because we established the landmarks earlier on, is designated by the broken line here. So we can just rotate on the axial view the crosshair until we bring out the RCA ostium right there and measure the distance to the annular plane. It's kind of small. C to capture that. And then we'll do the same until we bring out the left main coronary artery ostium. That's more like it in terms of distance. And C for capture. And everything is in the output panel. We'll hit send, pick the server, and then hit OK. After sending, we'll hit delete all so that, again, the batches of images don't mix together. I have a reminder for myself to switch to the other series because I'm now done with the gated aortic root kind of CT portion. I need to load the CTA of the chest, abdomen, and pelvis that's non-gated. To do that, I click on this tool here up the top and left click that and find the CTA of the chest, abdomen, and pelvis from the list of series. And I believe it's this one. I can double check here on the preview. And yes, that is the CTA of the chest, abdomen, pelvis. Right click here, load the sub series, hit plus. So it will be series number 2. And click to this to minimize this window. And now I'll left click on 2 to switch over to the new series. I don't need to do this part from the Tavr protocol right now because we're not trying to segment the aortic root anymore. But that's just overview. All right, so I need to get back to my measurement protocol, but before I do so, I do try to get the curve planar reformat from the annulus to one of the legs. And now I'll activate the CPR tool. Zoom out, and then I usually try it from the most distal part. In this case, the SFA. Let's see if that gets everything proximal to it. Shift left click to try to get the center line. Kind of stopped at the distal abdominal aorta. I wanted it to go all the way to the annulus. So I'll delete all trees for now. Probably will need to use the multi-click. Or let's try the 2 clicks tool. Now I'm going to use the axial images to place my control points, connecting the annulus all the way to the, in this case, I'm picking the right superficial femoral artery right there. So shift left click. Let's see if it can create the center line. If not, then we need to use the, so it could not find the center line. We'll need to use the multi-click tool. Yeah, and if the acquisition was perfect, just shift left clicking on the SFA will create this center line. So now I'll have to do this manually, like shift left click there, like along the way, make sure the line will be followed all the way to the SFA. So when they're kind of reasonably straight, you can space them out more and just placing control points along the path from the annulus to the right SFA. So now I'm at the right external iliac artery. And CFA now, SFA right there, and hit finish when I'm done. That should create a reasonable center line for us from the, again, annulus to the right SFA. Just waiting for it to complete. I use the CPR tool because I'm going to march down from the ascending aorta to that right SFA, kind of. Kind of messed up there, so we'll delete all trees for now. Let's try to hit auto, see if that automatic option works better for us. Shift left click there at the distal SFA. Really likes to stop there. Oh, there you go. That kind of connected everything together after I shift left click on the distal abdominal aorta. Now I'm going to march up, kind of close to the heart. And then just troubleshooting here. Where the control, trying to find out where the control points kind of went awry. Here's where it kind of veered off course. I'll just try to redirect everything where it should be. And now I think we're below the not quite. I'm trying to get into the annular plane, and I think that's reasonable. We'll delete everything to the red dot, which is the more proximal part. And then let's try to view the control points now, see if we're there. Again, just troubleshooting here. In a better acquisition, this will be automatic center line drawing by the software. But here, I think we got a reasonable center line now from the annular plane all the way to the SFA. All right, so once I have that, I just hide all the labels for now and then reset the orientation like so, and then use the batch tool to send again 180-degree rotation of what I have right now in the curve planar preformatted images. So 24 number images and then 180-degree preview that, make sure everything is staying within the window, output that. All right, so it's saving 24 images, 180-degree rotation through that center line drawn from the annulus to the right SFA. And then output panel will have those images. We'll just send it over to the server and label that aorta to right lower extremity, hit OK. All right, so now I can bring back the labels. And with A, I'm gonna try to approximate the annulus, just right around there. I don't really need to measure anything. I'm just designating the plane. And then the first measurement I have for this part is 4 centimeters from the annular plane, just resetting orientation. So I'm not confused as to right versus left on the cross-section images. Right click, hide diameter measurement, because I'm going to produce my own measurements later on. And then go back to my measurement protocol, which is under my name for now, my initials. All right, so my first item after switching over to the non-gated portion of the CTA is 4 centimeters from the annulus. Again, I've picked out the appropriate tool. In this case, I think it's just the distance pair tool. Left click that, and then on the cross section is where we want to left click to activate. So we get the measurement. They're already pre-labeled as far as the variables, and then C to capture. And then we'll just maintain that same label, hit OK. And actually my next measurement, I'll just stay on this window here and move down to the abdominal aorta, just where it's narrowest visually, and resetting orientation along the way to make sure I'm not confused as to where I'm going. Usually the narrowest will be infrarenal unless there's an aneurysm and pre-bifurcation. So there's some mild disease. There's really no severe area of stenosis. So left click here to activate the tool, left click here to get the measurement, C to capture, and then moving on the right common iliac artery, you see how the contour is off, and if you're measuring there, that won't be accurate. So we just need to identify the narrowest portion here. Shift left click to edit that contour, and then again activate the tool, left click to measure, C to capture. Now we're moving over to the external iliac artery. C2 capture, and then looks like they've had a recent cath. There's some stranding, but anyway, this is the CFA, and then C2 capture. All right, so, and that's the right side. I'll just do the same for the kind of left coronary, not coronary, left iliac vessels to the femoral, common femoral. So I'll double click here. You'll notice it's building up, accumulating the measurements that we've made all the way to the 3D volume. And I'll have a nice kind of summary later on of measurements. Let's see if the CPR tool, deactivate that and activate again, can get the left side well. All right, got it. So I'll hide measurements for now because I'm going to send over the CPR images of the left side using the batch tool. So again, 24 images, 180 degrees preview to make sure everything looks good. Output that. And in this case, I don't think I've sent over the measurements from the ascending aorta to the right side. And it's okay, they'll all be in the output panel, including these recent CPR images. So in order to avoid them combining and confusing everybody, we'll just for now select the CPR images. So shift left click, and then we can right click here and then output selected images and we can hit send, and then pick the server, and we can just call it CPR aorta to left lower extremity, hit OK. Once that's OK, we can now delete the CPR images that we just sent, delete selected images, and then I'm going to continue measuring the left side so that all the measurements are together under one batch. Go back to viewer, and here go back to region and activate the labels. So I'm going to move all the way down here to the left side and then go back to my measurement protocol. I should be at the left CIA right there. So identify any point of narrowing or the narrowest part. No significant disease here. So activate the tool, measure the left CIA, C2 capture, move over to the external iliac, activate the tool, left click and left click to measure C2 capture. One last measurement of the left common femoral, pretty free of disease. Capture that. So now I'll have everything, all the measurements together in one batch, which I can now send to the server. And in this case, aorta to bilateral lower extremities, hit OK. And those will go over, delete after sending. And when I left double click here on this on the CPR images, I'll go back to the 3D. And on the line, any of the CPR kind of center lines, I can right click and then show measurement summary and double click on the 3D window and deactivate the CPR tool for now. I usually just change this to dot, so it's easier to see the labels and just kind of move the measurements so they're more visible. And I would capture this, C for capture, and it will be the lone capture for this batch. And yeah, it looks good. Send it over to the server and label it summary of measurements. And hit OK, delete all. And now I'll go back to the measurement protocol. And in here, right next to generate report, is this down arrowhead where I have the option to copy measurements to clipboard. And once I have that, I can just go to the dictation window and paste everything. Add the incidentals later on. So that's the beauty of this. So that's the Tavr protocol.